Hi, I am Arti Bhalerao. I'm the Chief Dietitian with Momstory. In today's session, we are going to discuss how to manage gestational hypertension with your diet. Developing BP during your pregnancy is going to increase the risk for maternal complications and also risk the baby's development. So, does diet play some role in its management? Let's explore. Before that, pregnancy is like a stress test for your later stages of life. So, if there is an incidence of pregnancy-induced hypertension, it also would indicate the development of hypertension 7 to 10 years post your postpartum period. Okay. Now, let's understand how does diet help you to manage the pregnancy-induced hypertension and what are the key diet strategies that are going to help us combat it. Diet during your pregnancy is going to help you maintain a healthy blood pressure. Number 2, it is going to help you to reduce your swelling. And third, it is going to help you to improve the rate of the baby's development, growth of baby's development. Okay. Now, what are the key diet strategies when we are managing the pregnancy-induced hypertension from a nutrition perspective? Step number 1 will call for focusing on a very good calcium intake. Now, how does calcium help to regulate your BP? So, your calcium helps your blood vessels to work more effectively. So, what are the dietary sources and when do we have it? How much do we have it? So, the dietary sources of calcium would be your green leafy vegetables, dairy products, and plant-based proteins, plant-based milk also you can be having to manage your calcium intake. How many servings? Usually 2 to 3 servings of calcium-rich foods on a daily basis are recommended. Just one word of caution, when you're having your dairy products, see to it that you are having it in a natural form without an added sugar or an added salt. Strategy 2 would be ensuring a very good protein intake. How does protein help us in managing the blood pressure? So, proteins in the diet help you to maintain a very good blood volume and it also helps with a very good rate of baby's development. What in the proteins? Yes, a lot of plant-based proteins with legumes and pulses, animal-based proteins with your chicken, fish, which are leaner kind of proteins, and also some extent, not a very good source, but healthy nuts into your diet also contribute to it. What is the step number 3? Step number 3, dietary strategy, is going to monitor your salt intake. When I say monitor, yes, we need to be very cautious of how much salt are we taking in our daily diet. It doesn't mean that we have to eliminate the salt completely, but yes, the salt to be restricted to not more than 5 grams in a day. You'll be surprised to know that a daily average salt intake of Indians has been studied to be around 11 grams. So, a conscious monitoring of salt is going to be very, very important. Avoid the added salts. A small tip would be always taste your food before adding the salt so that you know how much exactly to be added. Processed food, preserved foods to be minimized into your diet and see to it that the fruits and vegetables, if possible, can be eaten without the salads or the fruits to be eaten without an added salt or sugar. Adding a lot of omega-3 fatty acids into your diet. Now, this omega-3 fatty acid is going to help you to reduce the inflammation. Now, these would come from the sources like sardines, almonds, walnuts, fish. Do include them into your diet. So, what is the dietary pattern that we follow to manage the hypertension during pregnancy? So, the research and the evidence suggests that we follow a DASH diet. Not too complicated. The DASH diet is very simple to follow. Focus on eating half of your plate with vegetables and fruits. 1/4 plate should be your whole grain cereals and 1/4 plate should be your lean proteins with a very good inclusion of omega-3 fatty acids. To know more, you can always visit the contents that are available at our official platforms on YouTube, Instagram and Facebook. please monitor your weight. So your weight has a direct relation to the BP also. So see to it that the weight is always healthy. Choose good potassium based foods into your diet to manage your hypertension. Now these would be bananas, sweet potatoes, green leafy vegetables. A good kind of fruits into your diet are going to give us very good potassium sources. So at least 2 to 3 exchanges of these fruits and vegetables have to be included intentionally into your diet. Now you're going to also monitor a very good hydration. Maintain a very good water intake that is going to help you manage your BP into an effective manner. Some healthy swaps to manage or lower your salt intake would be addition of certain natural ingredients like lemons. So the taste into the lemons is going to help you to reduce the salt requirement. Certain spices like your cloves, elaichi, cinnamon are going to be very effective in giving you the masking for the salt taste. Also, curry leaves into your diet will help you to get a better flavor and thereby reduce the addition of salt into your diet. So goes with the inclusion of dates, raisins, and some healthy amounts of chilies into your diet, which is going to help you swap the salt addition into your diet for an effective control. Thank you. And for more information, please visit us at Momstory. Thank you.